This portion of New Day Northwest is sponsored by Bellevue Plastic Surgeons.
Every year, statistics show more and more people are choosing cosmetic plastic surgery. But you need to know not all surgeons have the same training and credentials. Dr. George Marosan from Bellevue Plastic Surgeons is here to explain the importance of choosing the right surgeon. It is great to see you again. Thank you for joining us today. So, just because you have a surgeon doesn't mean they're necessarily a plastic surgeon. Can you explain what it takes?
Correct. Everybody, most physicians in this country are certified in something,
right,
but they're not all plastic surgeons. So to be called a plastic surgeon, you have to go through training, and you have to be certified by the American Board of Plastic Surgery.
Okay.
That's the only board that certifies plastic surgeons.
So when you say you get a bad cut or something and you end up in the emergency room, when do you ask for a plastic surgeon, or when do you think you might need to have a plastic surgeon take care of your problems?
I think if you end up in the emergency room with a cut, especially on your face, you have the right to ask for a plastic surgeon, and you should.
And you should, yeah.
I mean, the ER physician will say, oh, I can fix that. And then later on, you end up in the plastic surgeon's office for revision because it wasn't put together well. So it's best to do it first time.
Exactly. Which, because then they end up in your office and you have to fix it, which we'll talk about in just a minute. So if you're going to choose an elective plastic surgery, what is it that you need to consider as you're choosing a plastic surgeon?
Well, you know, people have to do their homework. And many times I have patients in the office and they said, well, I did my homework, and they still don't know what the difference between a plastic surgeon and a cosmetic surgeon. Mm-hmm. So anybody can be a cosmetic surgeon.
Oh, interesting. Okay. That's a very fine distinction.
But very few people can be plastic surgeons.
Oh.
The training both in cosmetic and reconstructive. So, and a smaller percentage of even plastic surgeons belong to the American Society for Aesthetic Plastic Surgery, which is a cosmetic board. And actually, it's not a board, it's an organization that you have to be board certified by the American Board of Plastic Surgery only, you know, to become a member. So any other American Academy of this and that, they cannot become members of the aesthetic board.
Okay, so you are, when you're looking, when do you need one versus the other, or do you always want to go with the latter?
Well, you always want to go with a plastic surgeon.
Okay.
Because, as I said, anybody can be a cosmetic surgeon.
Okay, okay.
From family practice to oral surgeons can belong to the cosmetic surgery organization.
Okay.
So it doesn't mean they have the same training and the same understanding of the anatomy and the things that they do.
Interesting. That's really interesting. No. So you brought some examples of some befores and afters. You want to walk us through those and show us what we're looking at?
Sure. So this is a lady who, the top are the before and then the after. So she went and had the smart lipo done. As you can see, her abdominal wall was pretty much destroyed. You know, she's all scarred.
And this is from the liposuction?
From the liposuction.
Wow.
Again, you know, people hear smart lipo, they think, wow, that's the...
It's smart.
Yeah.
Yeah.
And the problem is, you know, if you can have the machine, but
if you don't know how to use it.
But it's a tool.
Yeah.
Like any other machines, it's a tool. So really the biggest tool is between the surgeon's ears. So you have to have surgical judgment and knowledge of anatomy and not create disasters like this.
Okay.
I had to do a tummy tuck on that lady just to correct it partially, and it will never be that good.
Right.
This is a lady who went to another cosmetic surgeon, and she had liposuction of her abdomen. It looked like she had a shark bite out of her lower belly.
Yeah.
And she's 68. And she thought, well, you know, I'm going to go to this guy who's a cosmetic surgeon.
Interesting.
So I had to do really a tummy tuck and some more liposuction of her back to kind of give her back some more balance and shape, you know, not to look not to look so abnormal.
Yeah. And then we'll go on to the next one and look at this.
Again, another smart lipo victim.
Oh, on the left is the before?
The before, the over-suctioning and scarring of the skin. I had to go back with the razor, release the skin, And in another step, I went back and I did some fat grafting. You can do some shifting of the fat by releasing it with the razor and moving it around.
So this is the same one.
Before, after, you know. Again,
Right.
not perfect because sometimes these corrections take 1 or 2 procedures, or sometimes 3. And, you know,
once you
think you go
destroyed some,
in, you know, you think you go in and you get something cheap. Sometimes cheap ends up like that.
Wow.
And
oh, my goodness.
And this is a patient that's taken without a flash, and you can see that even after, it's not fixable. I mean, this is just, I mean, with a flash, you know, you put on, wow, that looks great. Well, it doesn't look that great, you know, without it. You can see the irregularities.
So is this lipo as well?
Another smart lipo victim.
Yeah.
And lots of divots, you know, I tried to fix it. It was almost impossible. It's so scarred, so tight, so destroyed.
So obviously, the best advice is for people to do their homework, get a plastic surgeon, and talk to people about it. Get some good references, wouldn't you think?
That's
some great
or
results.
go to the website surgery.org, and that you can put in the name of the surgeon that you maybe had a consultation with and see if they actually even show up. If they don't, it's not a plastic surgeon. They can anybody, state law does not tell you what you call yourself. You know, you can get your medical license, you get the approval from the state, and you can call yourself plastic surgeon, cosmetic surgeon, and you can be a pediatrician. But, you know, so there's no laws against it. You call yourself what you want to call yourself.
Yeah, that's scary. That's scary stuff. I've learned a lot from you today, Dr. Marosan. Thank you so much. We will have more about Bellevue plastic surgery on our website after the show. But after the break, Dr. Marosan will come back. It's Wellness Wednesday's Doctor Panel when we come back.